I made a short table to understand, the scope of this pandemic. Initially, these direct victims, they are those so-called infected with the COVID-19 virus, and then they are not infected, but they are medically affected. There are many, especially the care center and the old people, those who have other disease, they are also heavily affected because many people were killed, of course, mainly by the COVID-19, but not necessarily directly by COVID-19. So that's why we have to see both, COVID-19 itself and also those who are affected. At the same time, because of government policy, lockdown, shutdown, there are a lot of heavy impact on socio-economic impact, which creates, contribute to the another type of human rights violation, especially economic, social, culture, right? And also because of government control, and also because of, this crisis, there are a lot of the xenophobic discrimination, as we see in the United States here and there, all the problem underlying, they are now also coming up, in the context of COVID-19, and then it becomes the governance crisis locally, nationally, and now the global governance, So question is, we have a different types of NGO, local, national, regional, global. We are all affected, one or another. We are addressing those challenges, but these challenges are all interconnected, So when it comes to international organization, as you see, we have a G20. I don't have to mention because already addressed by other speakers. And then UN also, we have a primarily the WHO, but everybody knows it's not really functioning. It's not performing very well. So the whole health governance. And then when it comes to humanitarian aid, we have WFP. And then UN Secretary General as a general coordination, he produced a lot of report and appeal, policy brief. I don't know whether it's really impact on the ground, because now it is the member states, not the international organization, that play the key role in addressing real problem on the ground. And then we have SDG, HLPF, July, but this is simply talk shop, the forum. It's not really a decision-making body. And also we have a human rights. As you know, human rights high commissioner and also many special rapporteurs did try very hard to bring the issue and monitoring, but they are not also effective enough to solving the real problem on the ground. By the way, there's a Human Rights Council taking place in Geneva now, And then, as Stefano mentioned, we have a financial economic issues, World Bank, IMF, So obviously we have many CSOs working on those international organizations even before pandemic. But because of this pandemic, there is a very interesting phenomenon, because it's a crossover, and there are a lot of exchange between the different groups because they need each other, So as we see, this is people's health movement, and they have been working on WHO, So their issue was access to vaccine, So now there is a war on vaccine. Who is going to invent the vaccine and how we are going to distribute, how much, whether there is a public access, free access, These are the huge issues. I think one of the top concern for many CSOs. And second one is humanitarian medical aid, the mask, sanitizer, personal protection equipment, and so on and so on. Medicine Sans Frontier, the Red Cross, they are also working on those issues. And then many of us also, we engage the civic space issues, because of lockdown and shutdown, there are a lot of, our freedom of expression assembly has been limited and then curtailed. So this is also another CSO advocacy issues, and also information right, For instance, Amnesty and Human Rights Watch, they also issue very strong statements about privacy, surveillance, infodemics, especially the CCTV, and then use of the IC technologies to trace, Of course, that is for the sake of the public's health, but it also can create a lot of the human rights problems, violations. And then the violence also one of the top issues for many CSOs, and because like India, I don't know how many people are really killed by the coronavirus, but a lot of people, so considerable number of people were killed during the lockdown, because of domestic violence, violence against women, violence against children. It's not only India, this is a universal problem, the Europe, Korea, everywhere, there's a violence, but this is invisible, So people are dying not because of the virus, but because of side effect, after effect, like domestic violence, and food crisis, and migrant refugees peace, and economic justice, and so climate justice, because as we know, one of the structural causes of this coronavirus was climate change, deforestation, and then the urbanization, and so on and so on. So I think the human rights environmental group also come into this the fight against the coronavirus, which means it's not only the specialized group or working on medical, and human rights group, humanitarian, economic, social, almost all cross sector, the civil society now engaging. But as you rightly point out, we don't have very good coordination mechanisms, because governments are divided, and UN also divided, a lot of fragmentation. So this is one of the key challenges. But I don't know, frankly, whether G20 can play their role. We had the virtual summit, but there is no serious follow-up mechanism. So I cannot propose at this stage, in terms of global governance, who and then which can play the leading role. And also, as many CSO criticize, UN Secretary General, I don't know, his leadership also in question, So now, and also, as we see, we have a China-US hegemonic, confrontation. So many people are saying, instead of G2, G0, So, this is a crisis of global governance, and then we are facing those challenges every day. So, in conclusion, to end with a positive note, my suggestion is, since many of us, not only the C20 process, but also UN and many others, I think we can kind of lose coordination, because there are so many issues, so many initiatives, we don't know who is doing what, So at least around the C20 group, maybe you can do mapping, and then we can continue this type of dialogue, not ad hoc, but more systematic manner, so that we can understand who is doing what, and where is the area for cooperation and synergy. I hope the meeting, the June meeting, can be the starting of the building the alliance with more information and strategies. Thank you. Let me stop here.